be tying your hair up a little bit just so we have access to take a look at your back. Is that comfortable?
Yes.
Sure it doesn't fall. So, just walk me through the symptoms that you've been having on your neck.
I've just been feeling a little tight around my trap area.
Okay.
Just a lot of tension and tightness.
Okay. Have you been doing anything out of the ordinary, working out, maybe a new exercise?
Nothing out of the ordinary. I've just been adding a little more weight to when I'm lifting, so maybe that could be it.
Okay. How would you describe the pain? Is it a dull pain, sharp?
It's pretty sharp.
Okay, so sharp on both sides?
Yes.
Okay. Okay. I'm going to be taking a look at your back, your spine, the alignment. We're going to do a few movements and assess your spine mobility. And then we'll see what kind of treatment we can carry out. Okay. There's a tiny bit of inflammation. Right around C5. Some tension. Like you mentioned on your traps, they feel pretty tight. How often do you lift weights?
Maybe like 3 to 4 times a week.
Okay. Do you tend to alternate the muscles that you're working? Do you give them enough time to recover?
Yes.
Okay.
Try.
Okay. I'm trying to feel inflammation alongside the spine. How's your form when you lift? Are you pretty good at?
Yeah, I try to keep my posture really straight. Just be aware of how I'm lifting.
One of the most important things that we often forget about when we're lifting heavy weights is to keep the core engaged, because that really helps support the spine.
Okay.
So just be very mindful of that when you're lifting. Now looking for inflammation on your shoulders, your scapula. So I definitely feel a little bit more inflammation on your right side. Checking for normal changes of temperature. Do my hands feel the same temperature to you as I slide them down?
Yes, they do.
Do they feel the same on either side of the spine?
Mm-hmm.
Okay. How about now?
Yes.
How about now?
Mm-hmm.
How about now?
Yes.
Okay. That's really good. Okay, so now I'm going to ask you to do a few movements for me. I just want to assess the mobility of your spine.
Okay.
Can you go ahead and try to touch your right shoulder with your right ear? Okay, just checking for any overextension of the muscle. Is there any pain here?
Yes.
Yeah. Okay. Let's do the other side. Is there a pain over here?
Mm-hmm.
Okay. Yeah, it's definitely a little bit tight. Go ahead and stay neutral. So that pain that you felt on your shoulders, how would you rate it from 0 to 10?
Maybe like 4 or 5.
Okay.
When it's present.
Does it hurt as much now, or it was a lot more when you were doing those movements?
Just as the days go by, it gets a little worse and worse each time.
Oh, okay. Does it hurt more if I press on it, or it's the same?
It was more when I was putting my head to one side where I could really feel it more.
Okay. Okay, go ahead and try to touch your chin to your chest. Okay. Any pain right here?
Actually, no.
No. Okay. Go ahead and now try to look up. Any pain right here?
No.
Okay, go ahead and stay neutral. Okay, I'm going to be assessing your jaw. Any tension right here? Is there any pain as I'm pressing?
Yes, a little bit.
On both sides?
Mm-hmm.
Okay.
I do clench my teeth while I sleep.
Okay. Yeah, there's definitely a little bit of tension right there. Does it hurt as I go down towards your...
Mm-hmm.
No.
Side.
Okay. Okay, can you go ahead and look towards me? Okay. Okay, now look to the other side. Okay. A little bit of tension right there as well. Okay. Okay, I'm gonna be tapping lightly on along your spine. Just let me know if you feel any pinching. Maybe you might feel like a sharp pain, or it could be some tingling. Anything that feels out of the ordinary, just please let me know. Nothing?
No, it was more when it was higher, when I felt a little sharpness.
Okay. So nothing down here. Okay. Does any of these feel worse than the other?
Mm-hmm.
Here?
Yes.
How about here?
Mm-hmm. Yeah, that vicinity right there.
Right here. Okay.
really
Let me know when it stops.
Yeah, okay, it's done.
So right about here. Okay. 12. Actually 13. Okay, so it's the top 13 centimeters of your spine that seem to be affected. Take a few measurements here. Right at the most prominent part of the shoulder. Go across. Right here. So that's 14.5 inches. Okay, 7.25. So that's perfectly symmetrical. Great. Just gonna grab a marker. I wanna make a few marks on your back to take a couple more measurements. I'll be locating a few important points on your back. So we've got the center of C5 right here. Okay. Okay. looking for the highest point of your scapula. Can you actually go ahead and try to touch the middle of your back with your left hand on the from the bottom? Right there. Just so I can easily trace this. Right here. Okay. Now we'll do the other side. Here. Go ahead and feel a little deviation of the spine towards the lower. You go ahead and try to touch your chin to your chest. Okay, you can return to neutral position. Okay. It's not too pronounced, so I'm not really concerned about it. Following your spine. Making sure that the spaces between your vertebrae are even. There's no pinching or deviation of the vertebrae. bit of misalignment on this side of your back, which could be because this is so tense and it's just pulling up. But it's perfectly midline, so that's great. Okay, Emily, we're going to start with some massage just along these muscles right here. I'm going to try to loosen up the knots that are causing so much tightness and pain.
Okay, thank you.
So I'm going to start with just some mild pressure, and you can just give me feedback as we go and we can adjust. Okay. I'm going to be using this anti-inflammatory oil. It's going to help us reduce that inflammation.
Okay.
It smells really good too.
Yeah, it does.
Okay, I'm going to come and wash up. And I'll be right back. Yeah, I can feel the fibers on the muscles.
Feels good.
Okay, I'm going to go pretty mild, and if you would like for me to increase the pressure, let me know. There's a tiny bit of redness after the session. That's normal, but it should go away within an hour. Start going down alongside the scapula. right side's a little bit worse.
Yeah, I can feel that now.
Yeah, it's a little bit tighter right here. I'm going to be applying some pressure. Just starting the neck, going down the shoulders. Okay, I'm going to be using this massage gun on the lowest setting. You feel a little bit funny at first, but
It's great.
if it's too much, please let me know. Okay, I already feel this area a lot looser. So that's great. Okay, I'm gonna go ahead and do some mild adjustments. We're just gonna be doing a few movements with your head. I'm gonna be changing my gloves so I don't put any oil on your face. Okay, so I'm just gonna ask you to let your neck loose. I'm just gonna be doing a few movements, okay? Okay, here I'm just applying a bit of traction, trying to elongate. Okay. Just gonna tie your hair back. It's falling. Okay. Okay. Do a few adjustments here. Any pain right there? Okay. Now I'm gonna be adjusting a little bit on your jaw to help you with the clenching, the pain. Okay. Okay, so we're gonna be adjusting the jaw. Can you go ahead and let it a little bit loose, kind of like half open? There you go. Okay. Okay, go ahead and take a deep breath right there. Exhale. Okay. Okay, one more time, deep breath. Okay, go ahead and let it loose. Now try to move your jaw to the right side. Okay, that's perfect. Now to the other side. Okay. Okay, go ahead, back to neutral. Perfect. Now, imagine that someone's pulling you from a string from this point on your head. Go ahead and try to straighten your spine as much as possible. Pulling up. Okay, great. Now go ahead and relax. Okay, so we're applying a little bit of traction right there. That's great. You can go ahead and raise your arm to the front all the way as far up as you can. Definitely feel your shoulder muscle. Very defined. Probably from your workouts, so that's great. Any pain right here?
tiniest bit.
Okay, go ahead and lower this. Now we're gonna do these. The left shoulder, go ahead and raise the arm. Okay, how about any pain over here?
Not so much on this side.
Okay, go ahead and lay. Okay, Emily, this should really help your shoulders feel better. I would go a little bit easy on the weightlifting, at least for any upper muscle, so you can focus more on legs, your core, and just give it a week,
Sure.
and then you should be good to go. Okay?
All right, thank you.
Do you have any questions?
I could still stretch.
Yes, a lot of stretching that would do wonders for your back, your neck. Okay.
Thank you, Ivy.
Yeah, no problem.